Welcome back to the 2023 APAICS Health Summit and our last panel of the day. I'm Madeline Milka, President and CEO. I'd like to introduce CAPAC's Senate Associate Member, Senator Catherine Cortez Masto. Senator Cortez Masto was elected to office in 2016 and was the first woman from Nevada and the first Latina elected to the United States Senate. Prior to holding office, she served 2 terms as Attorney General of Nevada. She sits on the Committee on Finance, the Committee on Banking, Housing, and Urban Affairs, the Committee on Energy and Natural Resources, and the Committee on Indian Affairs, and currently serves as the chair of the Energy and Natural Resources Committee's Public Lands, Forests, and Mining Subcommittee. She is committed to increasing healthcare access and introduced bipartisan drug pricing transparency legislation to reduce costs for those in Medicare and Medicaid and protect those vital programs. Welcome to the APAICS Health Summit, Senator Cortez Masto.
Hello, everyone. This is Senator Catherine Cortez Masto. I am so happy to introduce this panel of patient empowerment and language access, which are critical issues for the Asian American, Native Hawaiian, and Pacific Islander communities. Expanding access to quality healthcare throughout the state of Nevada has always been a priority of mine. I have worked to increase the number of physicians in our rural hospitals to ensure that every Nevadan can see a healthcare provider when they need one. And I've advocated for more widespread access to telehealth services, which benefit families across Nevada, including our seniors and our rural Nevadans. I know we also have to continue to lower costs for our families, and I was proud to help pass legislation to cap the price of insulin for seniors at $35 per month, making it easier for so many Nevadans to get life-saving medication. I stand with Asian American, Native Hawaiian, and Pacific Islander communities in the fight to expand healthcare access to all Nevadans and Americans across the country. Thank you for the work that you do to ensure we're having these important conversations.
Next, I'd like to introduce CAPAC First Vice Chair, Congresswoman Grace Meng, who represents New York's 6th Congressional District. She is the first and only Asian American member of Congress from the state of New York. In Congress, Congresswoman Meng serves on the House Appropriations Committee. She has fought to expand opportunities for communities of color and also serves as a co-chair of the House Bipartisan Task Force for Combating Anti-Semitism and as a vice chair of the LGBTQ+ Equality Caucus. Prior to being elected to Congress, Congresswoman Meng served in the New York State Assembly. Let's give a warm welcome to Congresswoman Grace Meng.
Hi everyone, I'm Congresswoman Grace Meng from Queens, New York. First, I want to thank APAICS for organizing their annual health summit and inviting me to speak. It's a pleasure to again be taking part in such an important event. The summit helps bring together key figures in the healthcare arena to identify and discuss crucial healthcare concerns facing our AANHPI communities around the U.S. Over the last 2 years, our communities have battled several issues and concerns surrounding the COVID-19 pandemic. And while we have made massive strides forward over the past few years, there is still much work to be done. A key part in ensuring our healthcare is accessible and adaptable to patients' needs is patient empowerment. Empowerment and autonomy provide an individual with a sense of security as they make personal medical decisions. However, far too often, minority communities face language barriers and cultural nuances that are lost in translation when individuals with limited English proficiency interface with the medical system, preventing patient empowerment. For our communities, this is especially true when we attempt to talk about mental health and mental health care. There are nuances and differences in the perceptions and stigmas surrounding mental health that can keep AANHPIs from receiving mental health care. That's why I introduced the Mental Health Workforce and Language Access Act. This bill would help ensure that community health centers have the resources to hire trained mental health professionals with language skills to provide resources and services to our communities whose primary language is not English. Culturally appropriate and linguistically accessible healthcare must be a cornerstone of our recovery efforts to truly restore our communities. While our healthcare system is one of the best in the world, it is far from perfect. Accessibility, affordability, and equality must be prioritized in the same way groundbreaking medical and pharmaceutical research is. We must continue to fight so that all Americans can access and afford high quality and holistic healthcare. Thank you again to APAICS, and I hope everyone enjoys the summit.
Thank you, Senator Cortez Masto and Congresswoman Meng, for your remarks. Our last panel of the day is Empowered Patient, the changing dynamics between patients and providers. Patient empowerment is a process through which individuals gain greater control over decisions and information affecting their own health. Empowering patients to actively participate in managing their care can enhance medical outcomes and lower costs. However, language barriers and cultural nuances can present challenges to ensuring AA and NHPI patients can effectively manage their healthcare. Access to in-language patient navigators, accessible tools, and accurate information can be essential to patient empowerment. This panel will discuss opportunities and challenges toward that goal. Our moderator for this session is Princess May, the Community Engagement Manager at the Asian and Pacific American Health Forum. Princess has extensive experience working for nonprofit and government organizations, including the Hawaii Children's Action Network as a public health research fellow, the Liliuokalani Trust as a community change initiatives intern, and the Hawaii State Department of Health as a disease investigator. Most recently, she was a project coordinator for the DOH-UH Contact Tracing Training Program and a public health advisor contracted by the Centers for Disease Control and Prevention. Let's welcome Princess and our final group of panelists.
Thank you, Madeline. Hello and welcome to the 2023 APEX Health Summit. My name is Princess May Visconde, and I'm a Community Engagement Manager at the Asian and Pacific Islander American Health Forum. I'm excited to have you all join us for the panel titled Empowered Patient, the Changing Dynamics Between Patients and Providers. Patient empowerment is a process through which individuals gain greater control over decisions and information affecting their own health. Empowering patients to actively participate in managing their care can enhance medical outcomes and lower costs. However, language barriers and cultural nuances can present challenges to ensuring AA and NHPI patients can effectively manage their healthcare. Access to in-language patient navigators, accessible tools, and accurate information can be essential to patient empowerment. This panel will discuss opportunities and challenges toward that goal. I'm honored to be joined by our wonderful panelists here today, whom I will ask to briefly introduce themselves. Jasmine, could you get us started?
Sure. Thank you, Princess. So my name is Jasmine Greenemeyer. I'm the head of Global Patient Advocacy at Bristol-Myers Squibb. I oversee our teams that include oncology, cardiovascular, hematology, immunology, and fibrosis, and also our early development team.
Great. Thanks, Jasmine. Thank you for joining us. Rita?
Hi, thank you so much for inviting me to be a part of this important panel. I'm Rita Kavahara, and I'm a primary care internal medicine physician who has cared for patients in large academic teaching hospitals, smaller community hospitals, and federally qualified community health centers. And in my experience working with diverse patients, I have seen firsthand the importance of patient empowerment, language access, and patient-centered care as an issue of patient safety and as a critical piece in preventing inequitable health outcomes. Before delving further into our conversation, I would like to preface our discussion by saying that I am speaking entirely in my personal capacity as a physician today and do not represent any organizations, institutions, or other entities in the remarks I give. Language access is a key component of patient empowerment for individuals most comfortable speaking a language other than English. It is critical for all patients to have access to a certified medical interpreter in all healthcare settings as an issue of patient safety. Early in the COVID-19 pandemic, before audio-only telehealth clinic appointments were temporarily allowed, for my clinic patients being seen by telehealth who required a medical interpreter, I had to place our phone interpreter on speakerphone and place that phone next to my laptop so that the phone interpreter could interpret what my patient was telling me through the video visit on my laptop, and then interpreted what I said to my patients on their laptop. As you may imagine, this was a major patient safety issue as no one could understand what the other person was saying, but this was temporarily resolved when three-way audio-only phone calls between the patient, the phone medical interpreter, and I were allowed by audio-only telehealth visits. All patients should also have full knowledge of their health condition, treatment options, treatment plans, concerning signs to look for that would warrant seeking medical attention, and how to prevent potential complications of their condition. More importantly, all patients should be empowered to ask questions, and patients' concerns should be taken seriously. There's a whole body of literature in the health equity space that highlights some of the factors contributing to racial and ethnic health disparities, and it is important that steps are taken to prevent this. When patients are being discharged from the hospital, the process can sometimes be rushed when hospitals are at capacity, as they have been many times during the COVID-19 pandemic. Cutting corners by not having certified medical interpreters available to explain what medication changes a patient needs, what to watch out for, and when and where to go for follow-up care can result in unnecessary disease complications, rehospitalizations, and even death. Further, only certified medical interpreters should be used, since medical terminology can be misinterpreted by a layperson attempting to interpret on behalf of a family member, and children should never be asked to interpret, as dangerous mistakes can be made, and children may also end up in a situation where they are explaining to a parent that their parent has a terminal diagnosis, or be placed in a situation where they are making medical decisions despite being a child. In addition, I would like to highlight the need for increased awareness among clinicians and patients regarding risk factors that may place individuals of certain ethnicities at greater risk of developing a disease, so that appropriate screening occurs to diagnose these conditions and prevent complications, such as the increased risk for heart disease and diabetes in the South Asian community. Lastly, I would like to emphasize the importance of collecting and using disaggregated racial and ethnic data to address inequitable health outcomes. Thank you, and I look forward to our discussion.
Great. Thank you so much, Rita. You brought up a lot of great points that I've heard from a lot of our community-based organizations who are patient navigators, community health workers, working in the communities, navigating through the healthcare system. And a lot of the barriers you shared from your personal experience, language barriers, access to care in general, are some of those difficulties and barriers that have been shared with me through some of the programs that I lead. And then Jasmine, it's your organization. Can you share a little bit more about your perspective on the changing dynamics between patients and providers?
Absolutely. Thank you, Princess. So, when we think about so much of the data telling us that patients and their unpaid family caregivers still don't feel heard in the clinical and research setting, and that there's still not enough community-based trials. So that's some of the immediate feedback that we often get. Then, as we were just talking about, you add these layers of culture or even multi-generational caregiving. And we feel that we do have a multifaceted role. So we can help with patient education, we can help with medical community and research training. And we're also very committed to helping advance medical professional representation. I know that was alluded to as well. So we're trying to address this on multiple fronts. And as a pharmaceutical company, we're taking it seriously to start with our own people. We're setting internal benchmarks and also hosting trainings and different various dialogues. But we're also very deliberate about our external partnerships and hopefully trying to inspire and set up more optimal dynamics between patients, caregivers, and their providers. And there's a few different ways I just want to showcase that. I'm very proud that we have a patient Asian network referred to as PAN. It's one of our people and business resource groups where we're working on promoting a workplace environment that values the contributions of our Asian colleagues and also help deepen the understanding with our Asian patients in the respective community. We have currently 3,600 members, and this is with chapters across the globe. And this feedback has definitely helped us, attract and retain our talent pool And it's also been very strategic and helpful in setting up our health equity initiatives and some of our partnerships. So just to name a few, we have a partnership with Drexel University. We're pan-matched biomedical STEM scholarship recipients with BMS mentors. We also have a partnership with Ascend, the largest Pan-Asian business professional membership organization in North America. And we also have partnerships to raise awareness of health disparities in oncology, where we're particularly looking at enhancing diversity in clinical trials. So in summary, I would say we know best to serve our patients, their family caregivers, and our providers by starting internally. And we think these insights and strategic partnerships of PAN can help enrich our company's culture and help us better serve the underserved communities. Thank you, Princess.
That's wonderful. Thank you so much, Jasmine. Rita, I know you spoke about this a little bit in your introduction, but could you share a little bit more kind of from your own experience about the changing dynamics as a provider yourself?
I think that it's really important to have clinicians and patients work collaboratively together and do everything that they can to make sure that the patient is empowered, because historically, I think patients often might have been afraid to ask questions or to gain a full understanding of their health conditions. And as we've seen, that when people don't have an understanding of the conditions they might have and what they can do to prevent worsening of the condition, what they can do to treat the condition, then they'll have poorer health outcomes. And when it comes to issues of language access, it becomes even more critical to make sure that those patients have the tools in order to ask those questions and receive the answers. And it's not just an issue of language interpretation, which that absolutely has to be there. You have to have the certified medical interpreters, but you also have to make sure that you're addressing some of the cultural issues and making sure that patients feel empowered to ask those questions, because the more questions you ask, the better health outcomes you might have. And so I think that there has been a shift from the past when it might have been the clinician says something and you just say yes and go with it, to asking questions and also bringing up concerns, because patients might not know that it's not normal to have a certain symptom go on for a certain amount of time or be ignoring other things. They need to understand that, yes, I should be telling my doctor this, or that my doctor might be wrong for a diagnosis, or maybe not all the treatment options have been presented. So asking some of those questions, asking for second opinions, all of that I think is very important to make sure patients are empowered to have those conversations.
Yeah, thanks, Rita. I completely agree with you. I think just that shared decision-making between patients and providers to ensure that they know what's going on, especially if it's their own health, and making sure moving forward that we provide kind of access and understanding and cultural humility when it comes to serving patients in the AA and HPI communities. Jasmine, I know you shared a little bit about this too, about kind of that access to care and that shared decision-making. So what are some major challenges to that? What is your organization doing to address some of those challenges?
No, I really appreciate the point around shared decision making, because when we talk about the environment, we continue to see that getting information to patients and their families at the right information at the right time continues to be a challenge. I was on the patient advocacy side. I was a leader within a colorectal cancer organization. And, I'm new to industry as of 6 years. And it's something I've seen on both sides of the house, right? That patients and caregivers always feel like they wish they would have had certain information about their treatment choices at a far earlier stage. And they better understood what all the spectrum of choices and what the implications were for them, with certain treatment choices. We always give the neuropathy example. If someone was a piano player, that's going to be very important for them to address that. And so just really encouraging patients and providers to have these more robust conversations. And, there's various partnerships that we're setting up to do that. We're also ensuring that we have our materials in multiple languages. We have that with our treatment materials, but also our clinical trials. And at this point, we have 13 different languages. But also we're working on that medical professional representation. And I'm really proud that our BMS Foundation made a $100 million 5-year investment to increase diversity in clinical trials. Because as we're alluding to have more culturally sensitive physicians, nurses, medical staff that are representative of the community at hand, we think can help patients and their family members feel more comfortable surfacing some of these questions, whether right there in the office appointment, or if there's other mediums, we alluded to telehealth, if there's different ways that we can help the community and individual patients feel more comfortable talking about their side effect issues or just the different concerns that need to be surfaced and to be addressed and supported.
Yeah, I really like what you said about representation. Representation definitely matters, especially when working with community-based organizations. When you talk to them and they share issues that they have working with different healthcare providers, something that often comes up is there's a lack of representation. It's not a provider that is from their community, and sometimes there is a lot of mistrust because there is a lack of understanding of a patient's own culture. For example, when you're providing health services around diabetes, are you making sure you're tailoring, say, your food suggestions to things that they actually eat that is culturally relevant to something they cook on a daily basis? Because you could suggest a bunch of different things that are healthy, but it may not be primarily part of their diet. And it's like, okay, then there is a disconnect. And how can a patient feel empowered to kind of respond and defend kind of their own culture when a provider itself doesn't fully understand what is going on that end? And so, Rita, I want to bring you into this conversation too, because as a physician, do you see this kind of dynamic between patients and providers about kind of a lack of cultural understanding or just a lack of understanding in general that prevent a patient from being empowered to kind of speak their truth and share more about their medical history?
Yes, certainly. And the example that you gave about food options for somebody with diabetes is spot on in terms of what I see when I see patients. It's critically important for any suggestions or medical increasing education around different conditions that's being done in a culturally appropriate manner. That being said, it can also sometimes be dangerous if you say that, oh, well, somebody isn't doing this because it's a cultural issue or something along those lines. So it's a fine balance that needs to be walked. But that being said, I think that it's absolutely critical that when you have somebody with diabetes or heart failure, or when you're giving suggestions how to modify diets, that you're doing it within the context of the foods that the person is most familiar with. Because if for any person, it would be very overwhelming if first you're told that you have this new disease, and then secondly, you're given a whole list of foods that you're not familiar with, that maybe the place that you go shopping doesn't have those specific foods, but has similar foods that you're more accustomed to. And so addressing it within that context is very important.
Right. And Jasmine, I saw you nodding your head. I don't know if you had anything else to add on that.
No, I always think it's so important, you hear the example sometimes that government workers have to actually live in the city that they're serving. And I always think of that example, you need to be aware of the grocery stores in the community, or, like what is accessible to people. So I think we're just making great examples of, you want medical professionals that can help extract this information and talk about a continuum of choices, right? Like, here's the most optimal thing, but even if you can increase your steps for 10 minutes of the day, goal is to work up to 20. If you can be eating 1 to 2 vegetables, just eating incremental steps, I think is very helpful.
Yeah, and it's just giving patients the tools to kind of manage their own healthcare so they feel empowered to do so.
And if I could jump into the thing that you alluded to, and I think you've received grants for, is having patient navigators, right? Because quite often in the medical setting, it's an 8-minute appointment. So to have realistic expectations of what's going to happen with the provider in that, but just making sure that there is space created within healthcare appointments to have these more targeted conversations, right? After this, and patient navigators often fill that void. We know nurses do to a great degree as well, but I think it's such an important point.
Yeah, definitely. Patient navigators play a huge role in navigating the healthcare system. And I think sometimes they go unnoticed. If you think about it, when you go in, you have what you mentioned, 8 minutes, but it's what they do with that 8 minutes. When they bring it home, all of the information they receive, do they actually understand the information they received? And I've spoken with the patient navigators within the program that I'm leading, and they're like, yeah, that 8 minutes just goes a long way, because then they spend hours and hours with them, either checking how much even the bill, seeing the health, the physician is, or just all the information they receive, the medication that they may have received, and they may not have fully understood it in those 8 minutes. But then that patient navigator really breaks it down with them, kind of making sure that they understand kind of the cultural implications as well, about how to kind of just navigate everything going on, and being that support for them and their family if they receive tough news from that healthcare visit as well. So lots of good conversations around this. So thank you both so much. Kind of just now looking at what are some opportunities or future possibilities that our community should be excited about? What does everything we mentioned look like for our communities?
When I think about, the exciting opportunities on the horizon, and by virtue of being, part of a pharmaceutical, the medicines we're investing in are getting more and more targeted, right? So precision medicine is the future of care. But there's a downside to this too, because the barrier of entry to get some of these medicines is very steep for individuals and for families. So at the same time, we're really committed to equitable access. And just to give an example of how much we're committed, in 2020, we committed $150 million over 5 years to accelerate and expand health equity. But we're doing this in 5 areas, specifically health disparities, clinical trial diversity, supplier diversity, workforce representation, employee and giving. And the reason I'm bringing this up, these are huge public health issues, and we know we can't do this alone. So I'm excited that multiple sectors are getting together to work on these from a more systemic point of view. And one of the ways that we're really leaning into this is to empower the communities directly, the community organizations that are right there in the community. So last year we funded 24 different nonprofits, and actually one of them was the Asian and Pacific Islander American Health Forum. Princess, you know this because this is your organization. But I bring it up because we're really wanting to lean into building capacity amongst the community. We're wanting, not just health education awareness, but leaning into, policy advocacy as well. So in sum, I just like that there's an investment being made directly to community organizations, because as you know, then the community's better served, right? That you understand the unique challenges and the unique opportunities. So I think it's an encouraging and overdue investment by the private sector. And one of the things too, that we're working on with our team is to think about multi-year grants, because we know how much it takes for community organizations to apply for 1 year's worth of funding. And it's something I hope we can do more of.
From a clinician standpoint, I think there are a few areas that are key moving forward. One is the fact that there is a real focus on health equity right now, which is critical to address the inequities that we have seen in all communities, as well as we need to move more towards team-based care, and we need the data available so that we can have research that reflects our community as a whole. And in terms of making patient decisions and treatment options and all of that can be influenced by the data that's available. And so in order to create plans for patients and empower patients, I think these are some of the critical areas that have a lot of attention right now and would be wonderful to see moving forward.
Yeah, thank you both. That gets me excited to kind of see the upcoming changes for our communities. Jasmine, I really like how you mentioned investments in community-based organizations. There's so many times when I speak to CBOs and just learn from them, because they have so much going on and they're doing incredible work in their communities. They're based in their community, they're part of the communities. And so being able to work with them, just kind of seeing how they navigate everything going on, all of the changes, COVID-19, health disparities that they're experiencing. So I'm so glad your organization is investing in community-based organizations because they are doing incredible work. And then Rita, to your point, health equity is definitely everything. Data drives change, and that's something I firmly believe in. So having research that kind of reflects our community as a whole, as you mentioned, so we're able to determine what is actually going on within our communities, what health disparities are impacting them, or what resources they actually need, and what we can do to fill those gaps. So I'm really excited to see what's to come for our community. So thank you both for sharing. And then Jasmine, I'll have you answer our next question. One is, how can government and private sector come together to better support those opportunities you mentioned?
So Princess, you asked how the government and private sector can come together to better support these opportunities. I think it's really clear, as we've been talking about as a panel, we can't do this alone, right? We've alluded to our various vantage points, the different resources that we have, the different expertise. And I think we all have something unique to bring to the table. In terms of partnering with the government, one area that we've been really excited about and leaning into is President Biden's Cancer Moonshot Initiative. Its promised use of medical innovation to reduce cancer mortality in the United States by 50% over the next 25 years is audacious, and something that we're excited about for patients, but also for researchers and what we can bring to the table there. The one thing, that we're always thinking about is to also ensure that we have public policies that are realized, that help realize these aspirations. So in closing, we're excited to work with our partners and many of you in the audience in the public sector to help advance the health of all communities. So on behalf of BMS and my team in particular, I'd like to thank you for this opportunity to have this dialogue. So thank you again.
Yes, thanks, Jasmine. Looking forward to working on behalf of our communities. And then Rita, this is kind of the last question that I'll ask both of you to answer, but Rita, I'll go to you. What does it mean to be an empowered patient?
An empowered patient is somebody who has the power to take control of their health, ask the questions that they need to ask, and have full awareness of what their health means in general, but also it's an empowered patient if they're able to access the care they need, have access to the affordable medicines, have access to the networks that are in place for them to be able to have the best health outcomes.
Great. Thanks, Rita. How about you, Jasmine? What does it mean to be an empowered patient?
I really like what Rita said. I mean, equitable access to information, resources, and for there to be no barriers or understood how they could overcome those barriers, to me, as a fully empowered patient.
Great. Well, thank you both for participating in the conversation, sharing what you do as an organization and what you do as a clinician. I think a lot of the information you both shared empower our A and NHPI communities and a lot of the work that our community-based organizations do to ensure that they are also working toward that goal. So thank you both for joining the panel today and sharing your insights and knowledge, and great to learn from both of you.
Our pleasure.
Thanks. Thanks for having us.
What a great day we've had together. I hope you've learned as much as I have from our amazing panelists and speakers. We greatly appreciate our summit partners, Biogen, Novartis, American Cancer Society, Cancer Action Network, AmerisourceBergen, Amgen, Bristol Myers Squibb, Campaign for Tobacco-Free Kids, Grail, Johnson & Johnson, Novo Nordisk, Planned Parenthood, Walgreens, as well as all of our panelists, moderators, and special guest speakers. Your support enables APAICS to fulfill its mission of promoting Asian American, Native Hawaiian, and Pacific Islander participation and representation at all levels of the political process, from community service to elected office. Please visit www.apaics.org to learn more about our work, and I look forward to seeing you the next time.